A heart attack occurs when blood flow to a part of your heart is blocked for a long enough time, that part of the heart muscle is damaged or dies. Your doctor calls this a myocardial infarction. Heart attack symptoms. A heart attack is a medical emergency. If you have symptoms of a heart attack, call 911 or your local emergency number right away. Do not try to drive yourself to the hospital. Do not delay. You are at greatest risk of sudden death in the early hours of a heart attack. Chest pain is the most common symptom of a heart attack. You may feel the pain in only one part of your body, or it may move from your chest to your arms, shoulder, neck, teeth, jaw, belly area, or back. The pain can be severe or mild. It can feel like a tight band around the chest, bad indigestion, something heavy sitting on your chest, squeezing or heavy pressure. The pain usually lasts longer than 20 minutes. Rest and a medicine called nitroglycerin may not completely relieve the pain of a heart attack. Symptoms may also go away and come back. Other symptoms of a heart attack include anxiety, cough, fainting, lightheadedness, dizziness, nausea or vomiting, palpitations, feeling like your heart is beating too fast or irregularly, shortness of breath, sweating, which may be very heavy. Some people, the elderly, people with diabetes, and women, may have little or no chest pain. Or, they may have unusual symptoms, shortness of breath, fatigue, weakness. A silent heart attack is a heart attack with no symptoms. Heart attack treatment. You will most likely first be treated in the emergency room. You will be hooked up to a heart monitor, so the healthcare team can look at how your heart is beating. The healthcare team will give you oxygen, so that your heart doesn't have to work as hard. An intravenous line, 4, will be placed into one of your veins. Medicines and fluids pass through this 4. You may get nitroglycerin and morphine to help reduce chest pain. Abnormal heartbeats, arrhythmias, are the leading cause of death in the first few hours of a heart attack. These arrhythmias may be treated with medications or cardioversion. Emergency treatments. Angioplasty is a procedure to open narrowed or blocked blood vessels that supply blood to the heart. Usually a small, metal mesh tube called a stent is placed at the same time. Angioplasty is often the first choice of treatment. It should be done within 90 minutes after you get to the hospital, and no later than 12 hours after a heart attack. A stent is a small, metal mesh tube that opens up, expands, inside a coronary artery. A stent is often placed after angioplasty. It helps prevent the artery from closing up again. You may be given drugs to break up the clot. It is best if these drugs are given within 3 hours of when you first felt the chest pain. This is called thrombolytic therapy. Some patients may also have heart bypass surgery to open narrowed or blocked blood vessels that supply blood to the heart. This procedure is also called open heart surgery. After your heart attack, the following drugs were given to most people after they have a heart attack. These drugs can help prevent another heart attack. Ask your doctor or nurse about these drugs. Antiplatelet drugs, blood thinners, such as aspirin, clopidogrel, Plavix, or warfarin, caromadine, to help keep your blood from clotting. Beta blockers, and ACE inhibitor are medicines to help protect your heart. Statins, or other drugs to improve your cholesterol levels. You may need to take some of these medicines for the rest of your life. Always talk to your healthcare provider before stopping or changing how you take any medicines. Any changes may be life-threatening. After a heart attack, you may feel sad. You may feel anxious and worry about being careful in everything you do. All of these feelings are normal. They go away for most people after 2 or 3 weeks. You may also feel tired when you leave the hospital to go home. Most people who have had a heart attack take part in a cardiac rehab program. While under the care of a doctor and nurses, you will slowly increase your exercise level, learn how to follow a healthy lifestyle, living a healthy lifestyle, to prevent another heart attack. Keep your blood pressure, blood sugar, and cholesterol under control. Don't smoke. Eat a heart-healthy diet rich in fruits, vegetables, and whole grains, and low in animal fat. Get plenty of exercise, at least 30 minutes a day, at least 5 days a week. Talk to your doctor first. Get checked and treated for depression. Limit yourself to no more than 1 drink a day for women, and no more than 2 drinks a day for men. Stay at a healthy weight. Aim for a body mass index, BMI, of between 18.5 and 24.9. Heart attack is a common disease, yet every individual needs unique treatment and care. We encourage people with heart attack and their families to learn as much as possible about the latest medical treatment and approaches, as well as healthy lifestyle choices. For more information about heart attack and how to treat heart attack, just click on the link at description. or visit www.mainmd.com. Thank you.